Everyone, the efficacy of two hemostasis methods, aluminum chloride versus electrocauterization in periapical surgery, was assessed in a randomized clinical study that was published at the JOE by Penarrocha Oltra in 2019 at the University of Valencia in Spain. I chose this paper because if bracelets, which are the epinephrine impregnated cotton pellets, are unavailable during epicoectomy, then we need other alternatives to control the bleeding effectively without compromising the surgical site visibility. Therefore, knowing the efficacy of other hemostatic agents, such as the aluminum chloride or other methods, such as the electrocauterization, would greatly help us to make informed choices. The study included 60 patients, 1 tooth per patient, presenting the periapical lesions located in maxillary anterior region, specifically incisors, canines, and premolars. Participants were randomly allocated into 2 equal groups, 30 each, using block randomization 1-to-1 generated through a randomization website. And the operator was aware of the assigned hemostatic method, and the 2 independent examiners who evaluated the outcome, which was the hemostatic efficacy, were blinded to the intervention. The outcome measured using a 3-point scale: 0 meaning no hemorrhage control, 1 slight but intermittent bleeding that is manageable, and 2 a complete hemorrhage control. In the aluminum chloride group, hemostasis was achieved chemically using X-Passil, is a paste containing aluminum chloride that was placed into the bone defect for 2 minutes and then rinsed with saline. And in the electrocauterization group, the bleeding was controlled by a thermal coagulation using a ball electrode to cauterize the bleeding bone surface. For the results, complete hemostasis was achieved in 80% of the cases treated with aluminum chloride compared to 60% in the electrocauterization group, indicating that the likelihood of achieving complete bleeding control was significantly higher when aluminum chloride was used. Also, the study found a relationship between the gender and the effectiveness of hemostasis, where female patients were 4.5 times more likely to achieve complete hemorrhage control compared to males. Finally, in my opinion, there's a notable limitation of this study, which is the use of a non-validated bleeding control scale to assess the hemostatic efficacy. Was adapted from previous studies. It lacks formal validation, and it introduces a degree of subjectivity and potential observer bias. Another limitation is the absence of assessment of the thermal effect of electrocauterization on the bone, as heat may cause tissue damage and affect the healing, yet this potential impact was not evaluated in the study. And that the study found that female patients were 4.5 times more likely than males to achieve complete hemostasis, but it did not provide a clear biological explanation for this finding. The difference could be due to physiological and vascular variation between the genders, such as smaller vessel diameters or hormonal influences or vasoconstriction and clotting mechanisms. However, given that the study did not measure any hormonal, hematologic, or vascular parameters, this result is more likely a statistical observation rather than a true biological effect. The finding that females showed better bleeding control than males should be interpreted with caution because it may reflect the sample composition, the random variation, or unmeasured confounding factors rather than a genuine gender-related differences in hemostatic response. Finally, in my opinion, although the study is a well-designed, randomized, controlled trial, the comparison between aluminum chloride and electrocauterization appears inadequate because the 2 hemostatic methods represents fundamentally different mechanisms of action. Aluminum chloride is a chemical agent that achieves hemostasis through local protein precipitation and vasoconstriction, whereas electrocauterization is a physical method that relies on thermal coagulation. And in my opinion, even though the study compares 2 different methods, it's still useful because it shows how effective each one can be. This helps us know which one of them could work as an alternative to the epinephrine infused pellets, especially when they aren't available. Thank you so much for listening. Hope you have a good day. Bye.